and welcome to the first video on anemia. I'd like to make a couple more going into the specific different types of anemia, but for this first one, I'm just going to cover a very basic overview of what anemia is and some signs and symptoms at the end of what you can expect in patients that have anemia. So just to start off, I think the first question we should be asking ourselves is, what is anemia? What is it that defines anemia? How do we know if someone's anemic? And very simply, you're going to be looking at red blood cell mass, which is a fancy way of just saying how much blood you have running through your body. So basically, you're looking at what is your capacity to oxygenate your tissue, right? Which is why we're looking at hemoglobin. So hemoglobin levels are really what's going to define anemia, and looking at a reduced red blood cell mass or reduced number of circulating red blood cells, etc., would be the literal definition of what anemia is. So now that we know what anemia is, the next question would be, okay, what values are normal? How do we know if hemoglobin levels are too high or too low, etc., since that's going to be our main marker to determine whether someone is anemic or not. And that number is 13.5 for males and 12.5 for females. So anything below that, the patient will be considered anemic. And so how do we measure circulating red blood cells? We already talked about hemoglobin. So very difficult to measure circulating red blood cells themselves. So we use different markers such as hemoglobin, but some other ones are hematocrit and red blood cell count. But you may be asking yourself, okay, why do we use hemoglobin? Well, hemoglobin is essentially something that is inside your red blood cells, and their job is to carry oxygen within the red blood cell. So that's why if somebody faints, for example, their skin may turn pale, they're not looking too good, they for some reason may have reduced blood flow to the head, and so that's why they fainted, right? And so their skin goes pale. And your skin goes pale like that because you don't have a lot of blood, right? Like in the area, that's what kind of gives you like your natural color of your skin is the blood that's flowing right throughout the body. So that hemoglobin is what's carrying the oxygen throughout your blood to all your tissue, your organs, etc. And so that if we measure hemoglobin in that way, then we can indirectly measure your red blood cell mass, and that can let us know if you're anemic or not. So how do we classify anemia? There are many different types of anemia, many different types of reasons why a patient may be anemic. And so to try and help us figure that out, we want to classify the anemia to help us narrow down the options. And so the main value we look at is the MCV, or the mean corpuscular volume. And essentially what that's showing us is the size of the red blood cell. And depending on the size of the red blood cell, we can narrow it down to different types of anemia and what may be causing it so we can treat it properly. The first type would be microcytic anemia, and that's when the value of MCV is below 80. Micro, that prefix, right? It may make you think of something that's small or smaller than it should be, and that's exactly what it is. The red blood cells in this case are a little bit smaller than they should be. And we'll go more into detail on all these different types of anemia in later videos. Then the next would be normocytic anemia, where the MCV is anywhere between 80 and 100. So the red blood cell size is actually normal, but the patient is anemic. And then you have macrocytic, where the MCV is above 100. So the red blood cells are abnormally large. And lastly, the signs and symptoms. So these are just very general, broad symptoms, right, that you would see with really any kind of anemia. So things like weakness, fatigue, pale conjunctiva and skin, headaches or lightheadedness, and pica. So probably the most common presentation for a very benign anemia, maybe like a iron deficiency anemia, which we'll get into in later videos, will be something like fatigue, maybe some pica, right, which is where you're craving dirt. So, your body's deficient in iron, so your hemoglobin can't function properly, it can't carry oxygen like it's supposed to in your red blood cells. And so to try and replenish that, your body's going to give you the craving of eating dirt, right, to try and seek iron. That's basically what that is. And fatigue, you're just not getting enough oxygen, right? So, I like to think about, like, if I'm exercising or working out, if I'm not breathing heavy, if I'm not getting enough oxygen, then I will have a harder time working out. I may feel more fatigued. I may feel like I'm going to faint because I'm pushing my body to its limits, right? I'm exercising, my heart's pumping, faster. My muscles are working harder, so they require more energy, more oxygen. And if you don't give them that, then they can't keep up, right, with what you're doing. So that's kind of how I think about it. Like, where it makes sense in my head, like, okay, I could see how I could feel fatigued. I may feel weak and tired if I don't have enough oxygen, right, flowing to the tissues, to the organs, to give them what they need, just on a regular day-to-day type of activities. So that's basically it. That's all I have for you guys today, and I hope you guys enjoyed, and I look forward to making the other videos on microcytic anemias, normocytic anemias, and microcytic anemias.